My name is Rosemary Spence, and I'm a nursing consultant in the Colorado Immunization section, and I'm going to be speaking about adolescent immunizations today. And I first want to do an overview of my presentation, and I'm going to be talking about three things. The first has to do with immunization coverage levels for teens, and it's the 2011 National Immunization Survey Teen, and we'll go into detail about that. Then we'll talk very briefly about the Advisory Committee on Immunization Practices, ACIP's recommendations for teens and their vaccinations. And then we'll finish up by talking about some of the barriers to immunizing adolescents and ways to overcome those. So first up, we'll talk about the NIS Teen. And I want to explain a little bit of background information about this survey. But it is a survey that's done by CDC, the Centers for Disease Control and Prevention. It's done annually, and it collects vaccination information on adolescents who are between the ages of 13 and 17. And it also does it for each of the 50 states and then some specific localities. It's done by using a random digit dialing phone survey, and guardians are contacted, guardians who have teens, and they are asked to identify and give permission for their adolescent's provider to be contacted and share that adolescent's immunizations with the survey. And so then surveys are mailed to the providers, and then the providers give detailed information about that particular adolescent, of course with the parents' consent. And what's measured is coverage for TDAP vaccine, HPV vaccine, MCV4 or meningococcal conjugate vaccine, and also any additional vaccines that may have been missed in childhood. For example, varicella, measles, mumps, rubella, and so on. And I want to highlight some of the 2011 key points, and 2011 data is the most recent data. The data typically is published in the MMWR in August or September, and so this is the most recent data we have, but it does tell us some very important things. And what we have seen pretty consistently is that nationally that there has been some substantial improvement in the coverage for adolescents between the ages of 13 and 17 for TDAP and MCV4 vaccines. In fact, the coverage for Tdap has improved so much that it has met our 2020 Healthy People objective of having 80% coverage for teens for Tdap. So that's the good news. The not so good news is that for the third year in a row, the increase for the HPV coverage has been about half what it's been for TDAP and MCV coverage. So while we're really making great strides with TDAP in particular, we're not doing the same so much for HPV vaccine. And what the survey also identifies is that HPV vaccine coverage for younger girls is lower than it is for older girls, which tells us that when adolescents come in who are 11 to 12 years of age, they may be getting Tdap, for example, but they're not getting HPV vaccine. It's a missed opportunity. And what the survey also tells us, which is pretty amazing, is that if we did not miss those opportunities, as in when they come in for TDAP at 11 to 12, we also did HPV and MCV4 routinely, we could increase our HPV coverage by 80%. It would go up to 80% coverage. So that's a very dramatic increase by just using that opportunity. I want you to have the most current information about where you can access the NIS Teen because it is updated annually. Here's the web address, and so be on the lookout late summer, early fall, because we'll have our 2012 data published then. I want to spend a few minutes going into more detail about the coverage for each vaccine. And for TDAP vaccine, you can see that the U.S. coverage is 78.2% in that 13 to 17 age group. And in Colorado, it's better than the national average. We really do very well in this. It's 84.7%. Probably some of that, if not a large part of it, is due to the fact that it's required for school entry. One dose of Tdap coverage was lower for those who were living in poverty. So we'll move on to the MCV4 vaccine coverage. You can see that the U.S. coverage is 70.5%. The Colorado coverage is a little bit lower. It's 64.4%. And coverage for one dose of the MCV4 was higher among Hispanics than whites. Now, HPV vaccine, we'll first talk about coverage for girls. And so what we see with the U.S. coverage is that 53% of girls received at least one dose of HPV vaccine. And of the girls who had started the series and had time to complete all 3 doses before they were contacted for the survey, approximately 71% of those had received all 3 of the recommended doses. And completion of the 3-dose series among those who had adequate time to complete the series, again before that interview date, was lower for those who were living below poverty. Now, the Colorado coverage, we can see that 45.9% of girls had received one dose of HPV, so that's a little bit lower than the national average of 53%. And then in addition to that, of the girls who had started the series and had time to complete all 3 doses by the time the survey was done, 62.7% had received all 3 recommended doses. So again, you can see that while we may be excelling for TDAP coverage compared to other states and localities, we are falling a little bit short in Colorado of having our HPV coverage for girls. Let's move on to coverage for boys. And I want to first say that the recommendation to routinely immunize all boys against HPV is a relatively new recommendation. It's come out in the last couple of years. Prior to that, it was called a provisional recommendation, and it meant basically that ACIP had recommended that you could immunize boys, but it wasn't routinely recommended like it was for girls. That has changed. And so now it is recommended that you routinely immunize boys against HPV. And so because this is a newer recommendation, you'd expect to see coverage that's a little bit lower compared to the girls, and you do. And in the U.S., the coverage for the boys for having received one dose of HPV vaccine is 8.3%. And again, of the boys who had time to complete the series, get all 3 doses, by the time the NIS teen interview happened, 28% had completed that. Now, Colorado does a little bit better for boys compared to the national rate. 13.6% of boys received at least one dose of HPV vaccine. So we still have a long ways to go on this, but it is a little bit better than the national average. So now we have kind of an overview of the coverage for the different vaccines for adolescents nationally and in our state. And I want to spend some time briefly talking about the ACIP recommendations for adolescent vaccines. And before I get into this, I just want to emphasize that because we have very limited time, this is just a synopsis. It's kind of like the Cliff Notes version. It's not the detail that we would get into about each vaccine if we had a little bit more time. I want to talk first about TDAP vaccine, Tdap, and there are 2 brands of it. The first is Boostrix, and it's made by GlaxoSmithKline, and it's approved for persons 10 years of age and older. Adolescent is made by Sanofi Pasteur, and it's approved for persons 11 through 64 years of age. And the ACIP recommendation for teens is that they get a single dose of TDAP between the ages of 11 to 18, and it really is preferable to give it at 11 or 12 years of age. Tdap can be administered regardless of the interval since the last TD. So what that means is if you had an adolescent or anybody who was needing TDAP who might have received a TD even the day before, it would be acceptable to give them a Tdap today. There's not a minimum interval. I want to talk about some newer recommendations having to do with TDAP, and the first one has to do with the 7 to 10-year-old recommendation. This is an ACIP recommendation, and it came out in January of 2011. And basically what it's saying is that if somebody has not received a DTaP series, for example, they didn't get 5 doses of pediatric DTaP, or they didn't get 4 with the 4th one being given on or after the 4th birthday, they are considered incomplete in their pertussis vaccination coverage. And so if they come into your office and they're 7 to 10 years of age, the recommendation is that you give them a dose of Tdap. And then this next one has to do with pregnant women, and doesn't matter if you're an adolescent, it has to do with pregnancy, but I am going to talk about it because we do see adolescents who are pregnant. This is an ACIP recommendation that was agreed upon in October of 2012, was recently published in the MMWR, and the recommendation is that healthcare personnel should administer a dose of Tdap during each pregnancy, irrespective of the patient's prior history of receiving Tdap. So if you had a woman come in who was pregnant 2 years ago, and let's say she got a Tdap during that pregnancy, and now she comes in, she's pregnant again, the recommendation is to give her another Tdap. You want to maximize the maternal antibody response and the transfer of the passive antibody to the infant. And for that reason, the optimal timing to give Tdap to a pregnant woman is between 27 and 36 weeks gestation. However, it is acceptable to give Tdap during any time of pregnancy. The goal of this basically is that you want to make sure that that mom is protected against pertussis so that she doesn't transfer it on to a newborn baby who is too young to be immunized. And so if the mom does not receive Tdap during her pregnancy, the recommendation is that she get it immediately in the postpartum period. Let's move on to meningococcal conjugate vaccine. There are 2 brands. One is Menactra. It's made by Sanofi Pasteur. It's licensed for those who are 9 months through 55 years of age. It isn't routinely recommended, for example, that you give it to somebody who is 9 months of age, but if they had certain high-risk medical conditions, you might give it. The second one is Menveo. It is manufactured by Novartis, and it's approved for persons 2 years through 55 years of age. And so the ACIP recommendation for adolescents is that you routinely administer a dose of MCV4 when they're 11 or 12 years of age, and that you give them a booster at age 16. And so you can see as we start talking about the vaccines, there's a common theme, and that is that they are recommended to be given at age 11 or 12, not to miss that opportunity to give them all at the same time. So in different syringes and different sites, we just have to say that as a reminder. If they come in and let's say they didn't get a dose at 11 or 12 years of age, and let's say now they're between the ages of 13 through 15, you want to give them a dose then. And if they did happen to get that dose at 13 through 15, that was their first dose, then you're going to give them a booster dose between the ages of 16 through 18 years. If they come in and they're 16 and older and they're in good health, 1 dose is enough. They don't need a booster dose. We're going to talk now about HPV vaccine, and there are 2 brands of them. And one of them is Gardasil. It's made by Merck. It's HPV4, and it's considered a quadrivalent vaccine. And it protects against 4 HPV types. And it protects against types 16 and 18, and those are considered high-risk HPV types. And basically what those are is that they account for 70% of cervical cancer. That's why they're considered high risk. In addition to that being protected for in the vaccine, it's also protection that's provided for type 6 and 11. Those, and I hate to use the term low risk, but that's what they're referred to because low risk implies that it really doesn't matter whether you're protected or not, and it does because 16 and 11 can cause different genital warts. And so you want to have both high risk, low risk protection, and HPV-4 will provide that. This vaccine is approved for females and males who are 9 through 26 years of age. The second product is a bivalent vaccine. It's HPV-2. It's Cervarix, and it protects against those high-risk 16 and 18. So again, you know, you're getting that protection against 16 and 18, and they account for 70% of cervical cancer. That's why, again, they're referred to high risk. But 16 and 18 also contribute to other types of anogenital cancer. So again, when you get protection against those two types, 16 and 18, you're getting protection against several different types of anogenital cancers, including cervical cancer. Cervarix does not include protection against type 6 and 11. It's approved for females, not males, 10 through 25 years of age. So we'll first talk about the ACIP recommendations for HPV for females. And the recommendation is that females be routinely vaccinated against HPV when they're 11 to 12 years of age. And then also, if a clinician decides to vaccinate as young as 9, that's acceptable. It is the clinician's discretion to vaccinate as young as 9 years of age. Again, it is routinely recommended for females at 11 to 12. And a catch-up vaccination is recommended if they didn't get routinely vaccinated at 11 or 12, that you catch them up in the series and that you do any catching up of doses that may need to occur when they're between the ages of 13 through 26. One of the questions that we get quite a bit is, what if somebody comes in, they started the series at age 25 and they never came back and now they're 27. Can you finish the series? And the answer is yes. So if you, for example, had somebody come in at 27, maybe they got a dose at 25, they got one at 26, they never came back till they were 27, it is acceptable to go ahead and finish them because you want to ensure, again, that they have adequate protection. We'll spend a few minutes talking about HPV vaccine for males. And again, newer recommendation, but it is now routinely recommended for males at 11 to 12 years of age. The vaccination series can be started as young as 9. And for catch-up vaccination for males, the recommendation is a little bit different than it is for females. It's 13 through 21 years of age. I do want to emphasize, though, that it's perfectly acceptable if you have somebody come in, maybe who's a male, 22, has never had any HPV vaccine, to go ahead and administer it all the way through 26 years of age. That's an acceptable use of the product. And all immunocompromised males, including those who've got HIV infection or men who have sex with men, through the age of 26 years of age should be vaccinated. Influenza vaccine, this is one we tend to kind of forget about a little bit when we think of adolescents. And it's really important, it's a routine recommendation that anybody who's 6 months of age or older, unless they have a contraindication to the vaccine, get a seasonal influenza vaccine that includes adolescents. Just some general information to keep in mind when you're immunizing adolescents. Not only do you, when they come in at 11 or 12, and you're not going to miss the opportunity, so you're going to do HPV, Tdap, MCV4, you also want to check their immunization history and see if they happen to miss any vaccines during childhood. So for example, if they missed varicella or MMR, you want to make sure that you administer it when they're in your office. And also, this is a more recent ACIP recommendation, but it's very important, and I want to spend a few minutes talking about it. But there has been an increase in the number of cases reported to VAERS, the Vaccine Adverse Event Reporting System, having to do with particularly adolescents fainting after they receive vaccines. And so it tends to be more of an increase in the 11 to 18-year-old female age group. Not impossible for adults either, but adolescents tend to be a little more prone to it. And as a result of that, you know, you don't always think about fainting being that serious. It's not that unusual for teens to faint when they get a shot. Anybody who's given shots has had it happen. But what we get really concerned about are the serious injuries that may happen as they faint, if they fall and hit their head and have a closed head injury. There have been some incidents where that's happened, where kids have had serious head injuries because they fainted after they got an immunization, adolescents, or they attempted to drive a motor vehicle and had some issues afterwards. So as a result of that, it's strongly encouraged that you observe them for 15 minutes after you give them an immunization. Have them seated while you do it. And just ask that they stay for 15 minutes after they're vaccinated so that you can observe them. They don't get up, leave your waiting room, go out in the hall, faint, and hit their head. That's what we're trying to avoid. I want to spend time talking about some resources that are available for clinicians, because I think when we do presentations and we go through information very quickly, you can leave and be completely overwhelmed. And what I have found helpful is if I know how to find the information when I'm working in a clinic. And I want to point out some very good resources. Each year there is a schedule for immunizations. It's for adults, it's also for children and for adolescents that CDC publishes. It typically comes out in an MMR the first week of February, the last week of January. The most recent one is the 2013 one, and it's available at this website. If you go on this website annually, you'll always get the most current version. Another great resource is the Centers for Disease Control and Prevention's vaccine page. They have vaccine information statements. They have the recommendations from ACIP. They have information about upcoming webinars, conferences, and so on. Another terrific one is the Immunization Action Coalition. They have vaccine information statements in every language. And what I also like about the IAC one is they produce great cheat sheets. So if you're really confused about this pneumococcal schedule, I know I am at this point because they've changed it a lot over the last couple of years, you can go to that website, print off that cheat sheet, put it up in your office, and really know what to do when you have particular patients come in who may have a schedule that's a little bit different because they're behind or they have certain high-risk medical conditions. They also do it for meningococcal vaccine, and so I would really encourage you to become familiar with that website. The Colorado Immunization section has a website. I've listed it up here. It has a lot of good resources on it, has good state information about what is required for school entry in our state for adolescents, for example. We also offer a service through the Colorado Immunization section at the State Health Department, and it's an on-call public health nurse consultant. And basically what it means is that you call this number, 303-692-2700, Monday through Friday, 8:30 to 5. And if you have a clinical question, you'll be put in touch with the nurse on call. So if you have a kid in your office, an adolescent, and this person has a very odd schedule because they're behind, you're not sure how to catch them up, or if some condition they have is whether it's contraindicated for a vaccine or not, you need some clinical guidance, we will be happy to help you. Just say that you need to be connected with the nurse consultant, and that person can assist you. That's a good resource. Some other ones are the National Foundation for Infectious Diseases. They have very good resources for clinicians about teen vaccines, but also for parents. The Children's Hospital of Philadelphia's Vaccine Education Center, again, FAQs for providers, but also the same materials similar for parents. The best resource I think there is having to do with immunizations is known as the Pink Book, but it's officially the Epidemiology and Prevention of Vaccine Preventable Diseases book. What I like about it is there's not any question you could have about immunizations that's not answered in the book. They also have very good cheat sheets that you can pull off in your office and look at when you have people in and you're making a decision about what to give them. And you don't have to go through pages and pages of materials to try to get your question answered. So this is a great resource. The Colorado Children's Immunization Coalition, CCIC, has some very good provider resources on their website. I'd encourage you to use that. And then also the last one, the Be Confident HPV Education Campaign. It's a campaign, it targets HPV, it has information for clinicians, but also information for teens and their parents. And it is the AWAN group that puts out this material, and I would encourage you to check that out. So we've talked now about coverage, what is routinely recommended for adolescents, and I want to spend a few minutes talking about some of the barriers to immunizing adolescents and how you can overcome them, because some of the barriers are similar to the barriers that we all see no matter if somebody's 2 months old or 102 when you're trying to immunize them, but there are also some that are very unique to adolescents, and we want to spend a few minutes on that. There's been a lot of literature done looking at what is it that physicians identify as to the barriers they have in immunizing adolescents. So first off, we'll talk about the barriers that physicians have identified to immunizing adolescents. One of them has to do with lack of adequate reimbursement for vaccines. If you've purchased vaccines for your office, you know some of these newer ones for adolescents are among the most expensive there are, and that's a barrier for physician offices. A big one is not seeing adolescent patients more than once or twice a year. So for example, if you have a baby, there are a lot of well child visits that are established. 2 months, 4 months, anticipatory guidance, and those are good times to also do immunizations. That isn't the case for adolescents, and so usually when they're being seen, it's sporadic, it may be for an occasional sports physical or an injury, and so it's harder to get them immunized because you just don't see them as much, or to complete a series, for example, HPV. Lack of time during patient visits to address vaccinations. There's a lot to discuss with adolescents. A lot of anticipatory guidance. You may run out of time to do immunizations. This one is not unique to adolescents, but it certainly is part of that, and that is difficulty in assessing a vaccination history and verifying what was given in the past, what was not given, so that you know what to give today without over-immunizing or under-immunizing because you don't have an adequate record. This one is a big one. Lack of confidence in addressing adolescent immunizations. It may be hard to have a discussion with a teen or that teen's parent about HPV vaccine because of the issue with sexuality, and it brings up that discussion, and some providers may or may not be comfortable discussing that. Another piece of that is because the vaccines are newer, staff may not be as knowledgeable or as confident in using the vaccines, and that's understandable as well. A lack of school entry mandates can result in lower coverage, and a lack of reminder recall system. That's what providers have identified as barriers to immunizing teens. There also has been a lot of literature about what have adolescents and their parents identified as to why they may not get immunized. Those include a lack of knowledge regarding the vaccine-preventable diseases and the vaccines. For example, you may have a child who's 11 and they went to kindergarten, and at the time of kindergarten they were up to date with their immunizations. There were not ones at that time recommended for teens. You thought you were done, and understandably so. And in the meantime, all of these new vaccines were recommended for adolescents, and you may not be aware of them. So that's a barrier. No medical home for ongoing medical care. We all know that teens may not have a physician, or they may go to different sources for medical care, maybe family planning clinics, school-based health centers. It may not be as easy to identify their medical home. Again, time constraints. I don't have time to take off from work and take my teenager who doesn't want to go down to get shots in there to get immunization. So that's a challenge. Cost concerns. If you are underinsured, for example, and are paying for some of this out of pocket, it can get very expensive. And lack of transportation to a doctor's office was also something frequently identified by adolescents and their parents. So what are some ways to overcome some of these barriers? We talked about cost being a barrier. And so there's the Vaccines for Children program. If you're a provider, you're not enrolled, I'd encourage you to do so, because it enables you to provide vaccines for Medicaid, uninsured American Indian, Alaska Native, adolescents, for example, who are 18 years of age and under, and also that can be a considerable saving for your patients. They either can get the vaccines at no cost or a very nominal fee. Underinsured adolescents 18 and under can also be immunized with VFC vaccines at federally qualified health centers and rural health clinics. If you're not enrolled, or if you have more questions about the program, I put some contact information up on the slide so that you can get more information. So what about infrequent healthcare visits? I said a minute ago that doctors had identified the issue with teens just don't come into the office as often. And we also talked earlier about how most of the vaccines are recommended at 11 to 12. And if all were given, we could increase our HPV coverage up to 80%, for example, by not missing that opportunity. So all of this has come together and resulted in the recommendation for a preventive care visit for teens at 11 to 12 years of age, similar to what we see routinely for very young children. And this 11 to 12-year preventive care visit's been endorsed by the AAP, the CDC, and the Society for Adolescent Health and Medicine, SAM. So if you are in an office and you have not routinely established a preventive care visit for teens at 11 to 12, I'd encourage you to do so, and when you have them in, make sure that you are giving them everything that's recommended for that age. The objectives of the visit are for preventive care, not just immunizations. While those are very, very important, there are many aspects of preventive care in addition to vaccinations that should occur. Again, you want to catch up those vaccines that somebody missed during childhood, and you want to introduce these newer vaccines, the HPV, meningococcal, and so on, because not all parents are aware. It may not have existed when their child was younger. Lack of immunization history and reminder recall. If you're not a member of CIS, the Colorado Immunization Information System, that's our registry in Colorado. I'd encourage you to do so. It's a confidential population-based computerized information system, and it collects data on the immunizations of all Coloradans across the lifespan. It's operated by the Colorado Department of Health. If you need additional information, the contact information is up on the slide. The advantage to joining this is then when adolescents or patients of any age come into your office and you're not sure what their vaccination history is, so you're not sure what to give them today, the more complete record that's available, the better chance you have of not over or under immunizing. And the more providers there are that submit data to the registry, the bigger picture we have and the more detail so that we can make the best clinical decision for an adolescent. So what about lack of information? We talked about that. There's some really good parent resources out there. And one of those is a website. It's part of the CDC vaccines website, but it is targeting teens and their parents. And they have done a lot of work on it in the last year. They've added e-cards, they have videos on it, they have posters, flyers. I'd encourage you to check that out. The AAP also has some very good information about adolescent vaccines on their websites. CCIC does. NFID, we talked about them a minute ago. They do. One of the things they have that I really like, it's geared toward parents, and it's 10 reasons to vaccinate your adolescent. And it lists reasons that we typically think of, but it lists some ones people don't always think of. For example, you don't want your adolescent to have a vaccine-preventable disease and expose an elderly grandparent to it or a newborn baby. Pertussis is a great example of the newborn baby issue, because your adolescent wasn't immunized. And so it helps parents look at it from a lot of different angles. Again, CHOP, the Vaccine Education Center, has some great parent resources about vaccine safety, frequently asked questions about HPV, MCV vaccines. And the National Meningitis Association has excellent information about meningococcal disease and the vaccines that prevent it. There also are some sites that are designed specifically now for adolescents. And the goal of this is to help them maybe take more ownership of their health. And CDC has some kid-friendly sites, and if you get on there and look, they have interactive videos, games, and the point of it is so that adolescents can learn more about vaccines and the diseases they prevent. In addition, the parents of kids with infectious diseases, PKids, they have done a vaccine initiative. It's called Get Vaxxed. And if you go on that website, it will direct you to materials, and they're actually fun. There are interactive videos and so on for younger adolescents and older adolescents, those who are 19 and older, for example. So I'd encourage you to check that out. And so I'm going to wrap it up, and do you have any questions?